questions that I would recommend a patient asks when they come and see me, and when they're coming to see me for a dental implant. And I think what patients, it's really good for patients to remember is that I and we here at the clinic are also patients for other things. So I've had to attend to see other surgeons for consultations for myself. So it's really important to have sort of an inside track on what questions should I ask. First thing I think, if you're going to undertake a dental implant procedure, is to talk to the surgeon about how many dental implants they've done. I know that seems obvious, but there's a huge range with surgeons on about how many they've placed. And although numbers aren't everything, there's certainly a level of expertise that is required to do this properly, and a level of expertise which denotes that someone is actually reasonably well experienced. So I've placed over 6,000 dental implants, and that's often reassuring for patients that have obviously seen quite a lot of dental implants go out. The next question we should ask is, how long have you been carrying out this treatment? Because again, we need to understand the longevity of treatments from our own patients to see how long they last. And so I've been placing dental implants for around 23 years at the present time. And understanding how long your surgeon has placed implants for, and in conjunction with how many they've placed, is an interesting way to sort of assess whether that's the surgeon for you. Also asking how many have worked. So how many of your implants actually stay in? And so as implant practitioners, we should know that, we should measure our numbers really carefully. And so to understand that the Campbell Clinic, we know that year on year, our average is about 98% survival rate for implants, as measured by the industry standard 1 year survival. And that's a really high number and really good. So ask your clinician that, ask them how many of your implants have worked, how many have been successful. Which implant system do you use? That's a really critical question. Not all implant systems are the same. In the same way that not all car manufacturers are the same, or all watchmakers are the same, or all washing powders are the same. So dental implant systems vary in a marketplace from cheap implant systems to expensive implant systems, and there's usually a benefit to some systems over other systems. So ask your clinician which system they use and why. And the final question that you must always ask is, what are the advantages and disadvantages of this treatment? What could go wrong? Could I be left worse off than when I started? And ask your clinician who's looking after you to go through that with you, to help you to understand whether this treatment is something for you